Welcome to the First Responder Training by VITAL's Project Freedom. VITAL is a strategic partnership between the University of Alabama and state agencies to improve wellness across the state of Alabama. Project Freedom stands for First Responder Expansion of Education and Distribution of Overdose Medication, and aims to decrease the adverse effects of opioids among Alabama residents through training, education, and awareness. Additionally, Project Freedom provides access to the opioid overdose reversal medication Naloxone. Part 1. Naloxone Administration Refresher. This training presents information on opioids and the harmful effects of opioid use. This training will also provide you with the skills to identify signs and symptoms of an opioid overdose and how to administer naloxone when an opioid overdose is suspected. Opioids are a class of drugs used to reduce pain. Common prescription opioids are oxycodone, hydrocodone, morphine, methadone, and fentanyl. Illegal opioids include heroin, illegally produced fentanyl, and other illegally produced synthetic opioids. Endogenous opioids occur naturally inside the body. The most familiar type is endorphins, which are released during pleasurable activities. When these naturally occurring opioids attach to the receptors in the brain, they can suppress pain and produce a sense of calm. The same effects happen when a person uses a prescription opioid. The same receptors also regulate breathing. Excessive stimulation of opioid receptors can lead to respiratory depression, respiratory arrest, and death. An opioid overdose occurs when a person takes too much of an opioid or a combination of opioids and other substances, such as alcohol, sedatives, or stimulants. Too much varies from person to person, depending on their opioid tolerance and the potency of the opioid they ingested. While some people have a high risk of experiencing an opioid overdose, it is important to note that anyone who has access to opioids may be at risk for opioid overdose. In 2022, more than 109,000 people died from a drug overdose in the United States, and of those, over 2/3 involved opioids. Can you recognize an opioid overdose? Let's discuss the signs and symptoms of an opioid overdose. Generally, when someone is overdosing on opioids, their breathing is difficult, or they may appear to be choking. There may also be a gurgling or snoring sound, often called the death rattle. The skin may be pale or clammy, and the fingernails and lips may turn blue or purple due to lack of oxygen. A person who is experiencing an opioid overdose may not wake up with stimulation. This means that the person does not respond after being shaken or pinched. Also, the person may not be able to speak. As an opioid overdose progresses, breathing will continue to slow down until it has completely stopped. An opioid overdose can lead to a heart attack, a seizure, a stroke, and death. If you suspect the person is experiencing an opioid overdose, administer the opioid overdose reversal medication Naloxone. Naloxone is used to save lives when an opioid overdose is suspected. Project Freedom distributes the 4 mg Naloxone nasal spray. The following video will demonstrate how to administer Naloxone nasal spray. The United States has seen an increase in opioid deaths since the opioid crisis began in the 1990s, with more than 1 million people dying from a drug overdose since 1999. The third wave of the opioid crisis began in 2013 with the introduction of synthetic opioids, mainly illicit manufactured fentanyl. The market for illicit fentanyl continues to change, with it being found in combination with heroin, counterfeit pills, cocaine, and other substances, and deaths involving multiple drugs. The Centers for Disease Control and Prevention states, in 2021, that nearly 88% of opioid-involved overdose deaths include a synthetic opioid such as fentanyl. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine. A lethal dose of fentanyl is considered to be 2 milligrams. The DEA states that more than 59 million fentanyl-laced fake pills and more than 13,000 pounds of fentanyl powder were seized in 2022. These seizures are equivalent to 396 million lethal doses of fentanyl. Signs of opioid overdose. Those first on the scene may not know if the person is experiencing an overdose or if the overdose is caused by an opioid. It is best to treat all encounters as if it is an opioid overdose. Naloxone is not harmful to people who are not experiencing an opioid overdose. Signs of an opioid overdose can include small, constricted, pinpoint pupils, falling asleep or losing consciousness, slow, weak, or no breathing, choking or gurgling sounds, limp body, cold and/or clammy skin, discolored skin, especially on lips and nails. Naloxone. Naloxone is an opioid antagonist, which means that it blocks the opioid from adhering to receptors, thereby reversing respiratory depression, sedation, hypotension, and analgesia caused by the opioid. It has a quick onset and does not have a long duration of action, which makes multiple doses necessary when the opioid is potent. Naloxone does not reverse the overdose effects of other substances. However, many of these substances being sold on the street are contaminated with fentanyl. Therefore, naloxone can and should be administered. Naloxone acts quickly, does not produce physical or psychological dependence, and has few side effects, most of which are minor. Overdose withdrawal, the most common side effect of naloxone, can cause shaking, sweating, nausea, and anger. Allergic reactions are rare. It is crucial to store naloxone at a temperature below 77 degrees Fahrenheit while avoiding freezing. Furthermore, it should be protected from light at all times. Please note, temperature excursions up to 104 degrees Fahrenheit are permissible. Also, be aware of the expiration date that is marked on each naloxone kit. How to administer naloxone. Check the person for unresponsiveness and slowed breathing. Lay the person on a flat surface and their back. Tilt head up. Call 911 if emergency medical services have not been contacted. Administer 1 full dose of naloxone in 1 nostril. There is 1 dose in each bottle. Do not prime the bottle. To do this, remove naloxone from packaging. Tilt the victim's head back. Position thumb on plunger and fingers on either side of the tip. Insert the tip into the victim's nostril until your fingers touch their nose. Firmly press the plunger until the entire dose is released. Then, continue rescue breathing if breathing remains slow. Wait 2-3 minutes. If the patient is not responsive and breathing continues to be slow, give a second dose in the other nostril. Depending on the potency of the ingested opioid and the medical history of the patient, more than 2 doses of naloxone may be needed to reverse an opioid overdose. With timely recognition of the signs and symptoms and proper administration of naloxone, potentially hundreds of lives can be saved. Let's review key points from the video. Before administering naloxone nasal spray, tilt the person's head upward. After administering the naloxone nasal spray, place the person in the recovery position and wait 2 to 3 minutes. If the person does not wake up 2 to 3 minutes after receiving naloxone, administer a second dose of naloxone, alternating nostrils if possible. Remember, naloxone works for a short time and is only effective in the body for 30 to 90 minutes. Individuals who receive naloxone to reverse an opioid overdose should remain under medical supervision for at least 2 hours after receiving the last dose. Let's learn more about naloxone. Naloxone is a safe medication used for over 40 years in emergency medicine. It displaces opioids from the receptors and temporarily blocks the effects of opioids. Naloxone is a medication, but it is not a controlled substance. It has no known side effects and can be used on pregnant women and children, including infants. Naloxone only works to reverse an opioid overdose. Overdoses involving fentanyl or other highly potent opioids may require multiple doses of naloxone to reverse the respiratory depression. Naloxone does not reverse an overdose of non-opioids. Still, naloxone is not harmful to people who are not experiencing an opioid overdose. Expired naloxone nasal spray can also be administered as an alternative if no other naloxone is available, but often requires multiple doses. Hundreds of people die every day from an opioid overdose, but with timely recognition of the signs and symptoms and proper administration of naloxone, potentially hundreds of lives can be saved. On your screen, you will see a QR code. Please scan the code with a camera on your phone to complete a 2-minute survey about the training you have just received about administering naloxone. Part 2. Fentanyl and occupational exposure to fentanyl. This portion of the training will discuss information about fentanyl and occupational exposure to fentanyl and other synthetic opioids. Fentanyl is a powerful synthetic drug similar to morphine and heroin. Fentanyl is up to 50 times more potent than heroin and up to 100 times stronger than morphine. It is a rapid-acting synthetic opioid that alleviates pain and works quickly to depress the central nervous system and respiratory functions. Exposure may be fatal. There are 2 types of fentanyl: pharmaceutical fentanyl and illegally made fentanyl. Pharmaceutical fentanyl is prescribed by doctors to treat severe pain, especially after surgery and for advanced stage cancer. Illegally made fentanyl is linked to the most recent cases of fentanyl-related overdoses. Illegally made fentanyl in powdered form is commonly mixed with drugs like heroin, cocaine, and methamphetamine and made into pills that are made to resemble other prescription opioids. In its liquid form, illegally made fentanyl can be found in nasal sprays, eye drops, and dropped onto paper or small candles. Illegal fentanyl powder can be white, pink, purple, blue, or green. 2 to 3 milligrams of fentanyl can induce respiratory depression, arrest, and death. 2 to 3 milligrams of fentanyl are comparable to 5 to 7 grains of salt. There are several known analogs of fentanyl. A fentanyl analog commonly found in illicit drugs is carfentanil. Carfentanil is 10,000 times more potent than morphine and 100 times more potent than fentanyl. Carfentanil is frequently used to tranquilize elephants and other large animals. For humans, a lethal dose of carfentanil is 0.02 milligrams. There is no known medical use for carfentanil in humans. Fentanyl exposure is a common concern for first responders and others whose occupations place them at high risk of contact with illicit drugs. It is important to note that leading science organizations advise that incidental skin contact with dry products will not likely cause overdoses. However, skin contact with liquid or gel can be highly toxic. Exposure to fentanyl can occur by inhalation of powders or aerosols, skin, eye, or mucous membrane absorption, incidental ingestion, hand to mouth, accidental injection with sharp objects or needles. To prevent occupational fentanyl exposure, we recommend the use of nitrile gloves. Nitrile gloves are known to be more puncture-resistant than vinyl or latex gloves and also have a longer wrist cuff for extra protection. The use of an approved respirator mask and appropriate eye protection. Avoid anything that may cause fentanyl powder to go airborne, and follow your departmental guides if the scene has large amounts of fentanyl. When leaving a scene where illicit drugs are present or suspected, we recommend you take off your gloves and dispose of them properly. Do not touch your eyes, mouth, nose, or skin after touching potentially contaminated surfaces. Wash your hands with cool water and soap. Do not use hand sanitizers. Hand sanitizers may act as an absorption and cause illicit substances to be absorbed through the skin. Remove and launder your clothing if contaminated. Shower if necessary. Dispose of single-use respirators and decontaminate any equipment according to your departmental policies. By following the recommended safety guidelines and adhering to departmental policies, first responders can protect themselves and others from occupational fentanyl exposure. Part 3. Compassion fatigue. Working as a first responder means responding to medical emergencies, managing crises, and strategizing threats of violence. The rewards that come from this line of work are immense, but experiencing secondhand trauma can take its toll. This section focuses on first responder compassion fatigue and the importance of self-care. Compassion fatigue refers to the emotional, physical, cognitive, and behavioral demands that can develop in first responders, making it more difficult to empathize with those in their care or security. Compassion fatigue is also referred to as secondary traumatic stress due to similar meanings of each phrase. Secondary traumatic stress happens when individuals witness the suffering of others or observe the suffering of individuals experiencing trauma. By seeing the trauma of others, individuals with secondary traumatic stress begin to feel some of the same symptoms. Some symptoms of compassion fatigue mimic PTSD. PTSD and compassion fatigue symptoms often overlap, with shared signs including difficulty sleeping, irritability, fear, flashbacks, and nightmares. The main difference between the two is that PTSD occurs when someone directly experiences trauma. Compassion fatigue occurs as a result of caring for another person who experiences trauma. More signs and symptoms of compassion fatigue include headaches, digestive problems, muscle tension, fatigue, sadness, grief, inability to feel empathy, feelings of dread, shifts in sleep, addiction, inability to concentrate, and changes in beliefs. Compassion fatigue can manifest in many ways. Some people may find that it affects their emotional and physical health. In contrast, others may notice symptoms within their behavioral and cognitive functions. After recognizing the signs and symptoms of compassion fatigue within yourself, it's important to develop an approach to seek support and create a self-care plan. Review the following list of self-care activities. Think of other activities that bring you joy and add them to the list. Pick a few strategies from the list to practice. Establish a self-care routine by spending a few minutes each day on a self-care activity or one day each week engaging in a self-care activity. After a few weeks of practicing self-care, consider your feelings. If signs and symptoms of compassion fatigue do not improve, consider professional care. It is important to remember that self-care is not a substitute for professional care. Work with a counselor, therapist. Spend time with people you love. Listen to, watch inspiring music or programming. Create a calming space to come home to. Journal about your days and leave the bad experiences on the page. Create a list of self-affirmations. Spend time in nature. Create lists of things that give you hope and faith. Find a physical activity you enjoy. Take time away from work for vacations or visit friends and family. Create boundaries. Post inspirational quotes in your personal space. Seek support from your partner, spouse. Coping with compassion fatigue can be challenging for anyone, especially first responders. However, understanding the signs and symptoms using self-care activities and knowing when to seek professional support are important for managing feelings associated with compassion fatigue. On your screen is a QR code. Please scan the code to access a survey regarding compassion fatigue. Please take a few minutes to complete a survey that helps us provide more training and resources to improve the overall health of first responders.